The matrix buttons are a very versatile product, originally created to help make a temporary crown. You simply heat them in hot water, whether it's microwaved or instant hot tap water or water bath. They will turn clear and soft. You roll it into an oblong shape, adapt it over the occlusal and down to the buccal and lingual. Try to avoid putting wrinkles by working the buccal and occlusal together. You cool it with the air syringe, and when it starts to turn white and opaque, remove it and set it aside. Once the crown prep is completed, you want to try the matrix button onto the prep area to make sure it's orientated and you know how to seat it properly. You can mix your temporary crown material, place it into the matrix button, and reset the matrix button. I like to put a cotton roll over the matrix and have the patient occlude onto it. It'll help to get your occlusion to be closer. Once the temporary is in the firm rubbery stage, remove the temporary and the matrix. Spring the matrix open and remove the temporary. You'll be able to trim it. You won't have to polish this temporary. It's very smooth. Just trim the margins and adjust your occlusion. If you want to use the matrix system to make a temporary bridge, you would take a matrix button or less than a full matrix button. You can pinch it into the pontic space to lock it into the interproximal area. Have the patient bite together. Cool it thoroughly, and then lubricate it with Vaseline. Then take two matrix buttons, adapt it over the posterior abutment, the pontic, and the anterior abutment. Get it down to the buccal and lingual. Have the patient occlude to establish a closer occlusion. Reestablish the buccal and lingual and cool it. When you remove it, you'll separate that pontic tooth and be ready to go on to make your temporary bridge at the end. Once the prep is completed and you want to make your temporary bridge, inject your temporary material of choice, seat this. You want to check it first to make sure you know how exactly it goes. Have the patient occlude and do as you would for the single crown.